are here again with another role play. In this role play, what we are going to do is a home visit, okay? And in this, it's a 64-year-old man. He has recently undergone a total knee replacement 3 weeks back, and a nurse is coming to visit him, and she finds out that he is not using the walker. We'll see how the conversation goes and how the nurse is initiating with it, and we'll see how the patient is going to respond. Okay.
Hi, we'll start the role play.
Okay.
So your time starts now.
Good afternoon.
Good afternoon.
My name is Tina Thomas, and I'm the registered nurse working in this community health center.
Okay.
And I have some notes about you, but is this the right time to talk to you?
Yes, you can.
Yes. So I would like to know your name, that is your first name and your last name for documentation purpose.
Sure. My name is Peter Thomas.
Peter Thomas.
Peter is my first name.
Okay.
And Thomas is the last name.
Okay, and how would you like me to address you?
You can call me Peter.
Peter. Okay, Peter. I have some case notes about you, as I told you earlier, and it's been said that you underwent a total knee replacement 3 weeks ago. Is
Yes,
that
that's
correct?
right. That's right.
Okay, how are you feeling today, Peter?
I'm feeling better now.
Okay, and actually I have come to check on you and to
Oh.
see how you are progressing with the walker
Oh.
and
okay.
how you are coping with every situation.
Oh, now I don't want a walker to walk because I can walk without it.
Okay, so if you don't mind, could you please tell me from when did you stop using the walker?
From last evening.
Last evening, and could you please tell me why you are not using the walker?
Like I've told you, now I can walk without the help of it. And also when I was using the walker, I feel disabled and very old. I'm
Okay.
just 64 years old. You know?
I really understand from your situation, because I know we all are very independent people and we try most of our life not to be dependent on others.
Yes.
I certainly understand from your point of view. But I have a small suggestion to tell you is that I would like to make you understand the importance of using walker and regarding your situation. If you don't mind, can I tell you?
Yes.
Yes. So actually, Peter, what you are going through is now you just finished with the surgery, and that's just 3 weeks back,
Yes.
and that is your knee, right? So the knee is the one which is carrying the whole weight in your body. Okay.
Okay.
So the walker is helping you and your knee. Okay. Otherwise, one fine day, your knee will even lead into trouble. You will have another knee also going in for a replacement.
Oh.
So what I'm suggesting you is that you don't need to use the walker for a long way, but at least till the next review when you see the doctor. How does that sound?
That's fine, but I think the doctor told me I need to use the walker just because I should not give much strain to my knee.
Yes.
But yesterday I found out that
Yes.
my knee is completely healed and I'm not feeling any pain any longer. So do I need to use it anymore?
Actually, I'm very happy to hear that you are not having any pain and you're able to cope with it. But still,
And also I'm following all other
managements like exercise.
Yes, I'm doing that. And I'm taking the medicines on time.
On time. Very good. I really appreciate you for you complying with everything. That's a very good news to hear.
Okay.
Only thing is regarding the walker. I do understand now you have less pain and you're able to walk. That's also very positive news to hear. But, you know, after 2 or 3 days, if you're not going to use with the walker, you will have slight pain coming up and you will have swelling on your knee. Maybe today, because yesterday you just stopped using the walker, you might not be noticing. But after 2 or 3 days, if you're going to do the same thing, again, there can be a problem happening. That's what I'm telling you. Until the next visit. The next visit is going to be scheduled within 2 or 3 weeks, right?
Yes.
So when you're going to see the doctor, till then, you please use the walker. Okay?
All right.
Mhm.
Then I can use it till then.
Okay, because if you're not going to use the walker, what will happen is you will not reach an optimal recovery. Okay, so you need to you need to recover a little more. It's a gradual phase, so please use your walker.
Okay.
And by the time when it comes to the appointment, when you need to see the doctor, you'll be able to finish using your thing. Okay.
All right.
Okay. Is there anything else that you would like to ask me?
No.
No. Okay, so once again, don't worry. I do understand that you are a very independent person. Only thing was we had a small confusion with the walker, and I guess it is okay now with you, right?
Yes.
About using the walker. So when you visit the physician or when you're going to visit your doctor, after that you don't need to use it again. Okay?
All right.
Okay. Thank you, Peter.
Thank you, Tina.
Okay.